Hi everyone, welcome to my channel. Thanks for tuning in. To my donors, thank you so much. This is for you guys and for anyone who has Lyme disease, who is interested in my treatment journey, who's interested in potentially taking Disulfiram themselves. This is just going to be a sort of informative video. I'm making a series of them to basically track my journey and hopefully track progression. It's a very unusual time, as I'm sure you can all relate to. Effectively, the UK went into complete lockdown as of today. So we're being told not to leave our house unless it's for essential shopping, preferably once a week, urgent medical appointments, and you are allowed to do one form of exercise per day outside of the house. Given me and my girlfriend both have chronic illnesses, exercise isn't really something that we can employ right now, just due to lack of physical energy, joint pain, muscle pain, that kind of thing. So we're pretty much confined to the four walls of our flat. I would urge people to please adhere to the government guidelines in whatever country you might be watching this. They're really important. You may think that you are invincible if you're young. I do have news for you. Young people are dying from this as well, even if they don't have underlying health conditions, so it can affect you too. And even if you don't display symptoms, if you come into contact with someone who's immunocompromised, like for instance my girlfriend who's got multiple sclerosis and is on immune system lowering medication, or if you give it to an elderly person, they could get very, very seriously ill. They could end up on a ventilator and they could potentially die. So please be considerate. Please don't be selfish. I know a huge majority of people watching this video can completely understand what I'm saying. Unfortunately, there is a slim minority of people who are sort of letting the team down. But do the best you can, like we are, and hopefully we'll get through this pandemic sooner rather than later. Okay, so treatment. I started about 2 weeks ago. I started on minocycline, an antibiotic, which is used to treat Lyme disease. It's also very effective at passing the blood-brain barrier. It has a very powerful effect on killing infections that are in the central nervous system, which is what mine is. Really good, really good. I've been feeling better than I have done for a long time, many years on this antibiotic. I haven't even been herxing, which is a sort of inflammation of pain that you get from bacterial and microbial die-off in your body. Haven't been getting any of that. I've been sleeping well. My energy's been better. My joint pain has really gone down. It's almost non-existent. My energy isn't amazing, but it's better than it was. I'd say overall I've probably improved about 5, maybe 10%, which is a great start given I'm not even on the main medication yet. We've decided we're going to stop me on the minocycline for now, because although I was feeling really great, I was getting some tingling in my feet, a bit of soreness in my calves. We want to be super careful. We want me to be in the best possible shape before starting the Disulfiram, which I'll probably be on for about 9 months. We're going to be taking a low and slow approach, so in starting the dosage very low, building up to a target dose over a series of months, and staying at that target dose for, I believe, 2 months, and then we're slowly going to wean me off the drug, by which point we're hoping that I'll be well. If not, we're kind of hoping maybe about 90% there. My blood test came back. I still do have Borrelia, which is Lyme disease, unfortunately, but at least we're able to treat it. The good news is we tested 3 co-infections, which are the main 3 most common ones. I'm negative for every one, which is great. It makes treatment a heck of a lot more complex, that's for sure. So negative for Babesia, negative for Bartonella. I treated both of those in America, and it seems I treated them effectively, which is great. And the other one was also negative, so that's good news. But yeah, excited about really getting going next week. My next in-person appointment isn't an in-person appointment because it's London-based. I'm immunocompromised. I cannot risk going into London for an appointment, so we're going to be doing it via Zoom. and my mum's going to dial in as well to give her thoughts. And yeah, from then on, I'm going to be seeing the clinic every 3 months. At the moment, it looks like it's going to be on the phone. But if the situation globally improves, then we could be doing in-person ones. They're also, I believe, regularly going to test my bloods every 3 months. I'm going to be having liver function tests as well. Unfortunately, I can't get through to my GP right now, who offered to do them. But because of the pandemic, I literally cannot get through to my GP on the phone. So I might just have to pay privately to get them done. It's about 24 quid a month, I think. But yeah, all things on the Lyme side are looking good. I am feeling a bit of guilt that I'm feeling physically better given the state that the world is in and the struggles that people are facing. Ourselves included, we've been hit financially quite hard by this in terms of work and that kind of thing. So we do feel your pain, but at the same time, we're really keen to help me get through this treatment so that I can work more if there's a job waiting for me after this pandemic, and sort of go back to sort of a more normal way of life. I just want to take this opportunity as well to thank my donors so far. We are still fundraising. Perhaps it's more important perhaps than ever at the moment, just because we've been hit financially by this. But yeah, thank you for following my journey. Any questions, just pop them in the comments box. I'll endeavour to answer all of them. And I'll speak to you soon.